You. Okay, we are constantly hearing about the diabetes epidemic in people, but did you realize that diabetes is also on the rise in pets?
That's right. Dr. Joel Conn is joining us from the Pismo Beach Veterinary Clinic this morning, and you have a few things to talk about every pet owner should know about diabetes.
Diabetes is a complicated disease, so I think the more you can know about it ahead of time, the better you are going to catch those symptoms early. And then, hopefully in some cases prevent that from occurring. So, basically what I want to talk about is kind of what is diabetes and then what can we do to both prevent and treat it. So just like in the human world, we have kind of two types of diabetes. Type 1, which is a failure to produce insulin. The pancreas in the body is the organ responsible for that. And insulin is what allows you to absorb sugar, essentially. Otherwise, it passes right through. Type 2 is a resistance to the insulin. So your body's producing insulin, but your body's also not responding to it like it should. And type 1 is also considered a juvenile onset. Type 2 would be kind of acquired later in life, adult onset. And we see these same exact things in pets. Basically, the signs to look for would be, the big one is drinking a lot and peeing a lot. And so that's what most owners bring their pets in for. But we can see more vague signs too, like lethargy, sometimes ravenous appetite, sometimes a poor appetite. It can almost kind of go either way. Very frequently we see weight loss, but you can also see weight gain. So any fluctuations in weight can be, especially if the diet hasn't changed, can be an indicator. And actually, if you're thinking, I think my dog drinks more, but I'm not sure exactly, you can actually quantify it. So if you can measure out over a 24-hour period how much your dog is drinking, it should be the normal water intake is their body weight in pounds times about 50. In a cat, it would be the body weight in pounds times about 30. And that gives you a total quantity over a 24-hour period. And you can actually look at that and see, is your pet drinking excessively? Sure. Unfortunately, even with treatment, survival time is only 2 to 3 years with diabetics from the time of diagnosis. And so the key is, if we can we try to prevent it. So a few things along those lines is, we know obesity is a huge factor, just like in humans.
Well, and that was a question I had. You said the increase in diabetes, even in pets. Is that something that we're seeing? Is that people more and more are not taking care of their pets' weight?
Yeah. So when we've talked about obesity in the past, it's huge. It's rampant, and I think most people don't realize anymore what a normal pet should look like. I actually have quite a few appointments. Over the course of a month, I probably have 2 or 3 appointments with owners bringing in their pets saying, "Oh, he's too thin," and I look at the pet and it's actually normal. And so that's happening more and more, and in cats especially, up to 20%, 25% of cats that are overweight, not even obese, but overweight, will develop diabetes at some point in their life. So it's really, really common. So keep your pet lean, and your veterinarian can help you with that. Here's an interesting case. This is a dog. This is Angus, and he's about 11-year-old now. He came to me with very vague symptoms. He first presented because this is an owner that's very active, and they go for runs, and he was kind of dragging on the leash. And it used to be he'd lead the charge. And so we thought, okay, he's a lab, he's an 80-pound lab, so he's a big boy. Probably we're dealing with arthritis here. And so initially, and he did have some evidence of arthritis. Initially, we put him on some anti-inflammatories, and he really didn't improve. And this is his normal lifestyle here. He loves to play on the beach. He wasn't doing this anymore.
That was familiar.
Over the next month, he still didn't improve. And during that period of time, the owner noticed, wow, he is drinking a lot. He is peeing a lot. And so we caught it very, very early. He came back in. The owner was astute enough to realize this was not normal for her dog. She's very in tune with her pet. And we ran some blood work, and sure enough, this guy was diabetic. Started him on insulin, we made some dietary changes, and he's good as new. So really, really important to pick it up early, and he's one that we caught very early in the game.
Is it because a lot of people are feeding the dog under the table and so healthy foods, I guess?
Yeah, some of that is, if you just cut out the table scraps, a lot of times for some pets, that's all it takes. But in other cases, I have people come in that say, you know what, I'm only feeding a cup. Why is my pet overweight? Well, it's pretty straightforward. If your pet is overweight, it's getting too much food. Bottom line. So cut the calories back. What I usually do is, first of all, make sure you're measuring the food, cut it back 20% right off the top. And that's the easiest way to do it. Spaying your pet actually can make a difference with diabetes risk. So intact female dogs are at higher risk because of the estrogen in their system. So spaying early can actually help with that, believe it or not. And females are predisposed. There are certain breeds too, things like breeds like Keeshans, Samoyeds, Schnauzers, some Dachshunds that are predisposed.
Okay.
Yeah.
And the other big risk factor is long-term use of steroids. So we're not talking anabolic steroids. So steroids used for allergies is a big one around here. Things like prednisone. Even in cases of autoimmune disease, we can see an increased risk. So just kind of be cautious with that.
Sure.
Talk that over with your veterinarian. And the key is, if your pet does become diabetic, be alert for those symptoms. Catch it early, because we have a much better chance of treating them successfully.
Sure.
Well, unfortunately, we are out of time, Dr. Conn, but very good information as always. Thank you so much for coming in and giving us this information. You can always email the vet if you do have questions. You can email him, askthevet at KCOY.com, and we will be right back with a check of your forecast and the Fastcast.